Today we're talking about shoulder injuries. And we see shoulder injuries on a regular basis in the clinic. And I typically think of shoulder injuries in about 5 different categories. The first is what we call a strain, or if it's more serious, a sprain type of shoulder injury. And if the injury progresses beyond that, I classify it accordingly as a tendonitis, and beyond that as a bursitis, and beyond that as an impingement, and in the most what I would consider serious category of symptomatic presentation would be a frozen shoulder. Frozen shoulder is where somebody walks into me and they have their arm in what I call a Napoleon posture because they're holding it against their body and they're in extreme pain. But let's think about the causes of each of these. Strains and even sprains can be due to a repetitive motion use. So it's just somebody who went out and they did something repetitively. It may be a surfer who just went out and spent too much time in the water. It may be a golfer who decided to play 2 full rounds of golf in a single day, but typically it's an overuse syndrome. Then the tendonitis and even to the bursitis category may be caused because somebody did something that was very traumatic to the joint itself. Typically, that may be a weightlifter who takes a weight that is inappropriate for their strength and tries to lift it, and they find themselves tearing the tendon or even inflaming the bursa. And so they'll have a tendonitis or a bursitis. Then there will be the category of people that I see, which I call chronic long-term abusers. And these are people who use the joint typically above shoulder level, and they use it day after day repetitively. And in my practice, a lot of times that is like framers who are framing a home. I may see it in electricians who are repetitively twisting above shoulder level, and this will cause impingement syndromes. Impingement syndromes are when the shoulder joint itself starts to literally pinch from below to above. And if you can see this, you think about the humerus as coming into the shoulder joint, and as that hits that bone above, the impingement occurs. And you can see that that joint should have a space for it to move. But if you do it repetitively and repetitively, then it starts to bang up against that bone, and this may cause what we term as an impingement syndrome. In the final phase, the joint is now so compromised and so inflamed that the patient can only effect relief by holding it against their body and supporting it so that it's not hanging down. This person is in extreme pain, they can't sleep on the shoulder, and typically that presentation is going to lead me to make other clinical decisions about appropriate treatment. Typically, if we're not into frozen shoulder, though, we can treat this actively. If it's a sprain, a strain, a tendonitis, even at times a bursitis, we can treat it with exercises and physical therapy modalities, as well as mobilization of the joint and manipulation of the spine that supports the shoulder, which is from the base of the neck to the base of the scapula or the shoulder blade. So we give the patient what we call wall exercises, which help to maximize the range of motion, or we give them standing exercises, which we call Codman exercises, or we may give bed exercises, again, to use gravity to help achieve the ranges of motion that we're seeking. Later on, we move the patient into TheraBand exercises and an appropriate time to strengthening. By this time, the patient is rehabilitated and back to work, and thankfully feeling much better, and the joint is returned to normal use. So that sounds like your problem, call us. We'd be happy to see you and take a look at it. Thank you.